Do you frequently feel like your bones hurt for no reason? Or has your child had rashes that just won't go away? What if I told you these could be signs of something rare hiding inside the body, like a friendly cell turning into a troublemaker? That's what happens in Histiocytosis X, now known as Langerhans Cell Histiocytosis, or LCH. Imagine your immune cells are like security guards in your body. In LCH, one type of guard, the Langerhans cell, starts multiplying too much and collecting in places like bones, skin, or even the lungs. Instead of protecting, they cause damage. It's rare, but it can affect children most often, though adults can get it too. Think of it like a small group of workers in a factory suddenly going off shift and causing chaos instead of helping. So what makes these security guard cells go rogue? Well, scientists don't know the exact trigger, yet know one single thing like a virus or germs we catch from others. But here's the interesting part. Recent studies show that in LCH, there are mutations in the genes inside the Langerhans cells. One common mistake is in a gene called BRAF, which tells cells when to grow. When its broken cells grow nonstop, kind of like a car with the gas pedal stuck. It's not passed from parents to kids like eye color, but it's a change that happens during life. It's not due to anything you did or didn't do, it's just bad luck at the cellular level. Ever hear of a typo in a book that changes the whole story? That's sort of what happens in the DNA. Now let's play detective. Have you or your child had unexplained fevers that keep coming back? Or maybe a limp that doesn't get better? These could be clues. LCH symptoms depend on where the rogue cells gather. If they collect in bones, you might feel pain or even have a fracture from a small fall, like stepping off a curb and your leg hurting for weeks. If in the skin, there could be a scaly red rash, often in the diaper area in babies, like a rash that won't clear up with normal creams. If near the eyes, you might see swelling or a puffy look. In the mouth, gums can be swollen and teeth may loosen. And if it affects the pituitary gland in the brain, a child might drink a lot of water and pee constantly, like filling and emptying a water bottle all day. It's not one single sign, but a mix that makes doctors suspicious. How do doctors find out if it is LCH? Think of it like solving a mystery. First, they ask questions and check symptoms like a health interview. Then come tests. An X-ray might show a hole in a bone, like someone took a tiny drill and made a dot in the skull. But the real proof comes from a biopsy. A small piece of skin bone or swollen tissue is taken and looked at under a microscope. Their doctors see the Langerhans cells with a special marker called CD1, like a fingerprint test, confirming the suspect. Once diagnosed, treatment depends on how severe it is. Mild cases might need just one medicine, like a steroid cream for skin rashes or fixing a single bone issue. But if many body parts are involved, stronger medicines like chemotherapy, yes, like cancer treatment, but not for cancer, may be used. The good news, many people, especially children, get better with treatment. It is like resetting the system after a software glitch. Right now, there's no sure way to prevent LCH because we don't know how or why the cell changes start. It's not like a cold you can avoid by washing hands or lung disease from smoking. But here's what you can do: stay alert. If your child has long-lasting fevers, rashes, or bone pain, don't brush it off. Early detection makes a big difference. It's like noticing a small smoke signal before a fire grows. Also, avoiding smoking, especially around kids, is wise, since LCH in adults often affects the lungs and is more common in smokers. You can't stop the cell mutation, but you can support your body's health and catch things early. Exciting things are happening in LCH research. Imagine drugs that don't just stop cells from growing, but fix the broken, stuck gas pedal, like the BRAF gene. Scientists are now using targeted therapies, medicines that aim straight at the faulty gene, like a GPS-guided missile. One drug, vemurafenib, is already helping some LCH patients with the BRAF mutation. Also, doctors are learning that LCH acts more like a rare immune system disorder than cancer, which changes how we treat it. New studies are tracking patients for years to see how best to treat long-term effects, like hormone problems. And guess what? There are global patient registries, like an international club sharing data to help find better cures. So while LCH is rare, science is paying close attention